Good evening, everyone. It is my pleasure to welcome all of you to this special event as we celebrate Black History Month. Before we begin, I would like to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, the Mississauga of the Credit. Today, this place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to learn and work on this land. My name is Jade Short, and I am the Alumni Relations Officer at the Lawrence Bloomberg Faculty of Nursing. Tonight's discussion is an opportunity to engage in critical conversations on leadership, policy advocacy, and system transformation. And we are joined by three incredible nursing professionals whose work is paving the way for a more equitable and inclusive healthcare system. Dr. Angela Cooper Brathwaite is a past president of the RNAO, co-chair of RNAO's Anti-Black Racism Task Force, and adjunct professor at Ontario Tech University. She has a PhD in nursing from the University of Toronto's Lawrence Bloomberg Faculty of Nursing, a Master's of Nursing from the University of Manitoba, and a Bachelor's in Nursing from Memorial University. As a fellow of the American Academy of Nursing, Dr. Cooper Brathwaite brings extensive experience in nursing leadership, administration, education, policy advocacy, health systems, and cultural competence. She has held executive leadership positions in acute care and has taught nursing at both Ontario Tech and the University of Toronto. Throughout her impressive career, she has received numerous academic and service awards, including the RNAO Leadership Awards in Political Action, the Leadership Award in Health Equity, the Order of Ontario, and the Order of Canada. She has published peer-reviewed papers in nursing journals focused on prevention of type 2 diabetes, culturally tailored interventions, and systemic racism in nursing, and serves as a reviewer for several nursing journals. Ovie Onagbeboma is a dynamic nurse leader, researcher, and advocate for equity in healthcare. She is the founder and chief executive officer of the Canadian Black Nurses Alliance, leading its national expansion and advancing initiatives that support Black nurses and nursing students. Ovie is a Lean Six Sigma Belt certified leader and a research associate at the Diversity Institute at the Toronto Metropolitan University, where she collaborates on projects addressing systemic barriers in healthcare. Additionally, she serves as an advisory member, to the Chief Nursing Officer of Canada, working alongside Health Canada to develop the National Nursing Retention Toolkit. A passionate advocate for diversity, equity, and inclusion, Ovie focuses on dismantling systemic racism in healthcare, creating inclusive spaces, and mentoring the next generation of nursing professionals. Her contributions have been recognized globally, including being honored among 100 accomplished Black Canadian women in 2024. And our moderator, Ava Onwudegwu, is an innovative healthcare leader, VP of the Canadian Black Nurses Alliance, and Director of Academic Relations. In addition, she's a clinical director at Lakeridge Health. She drives transformative initiatives, focuses on collaboration, and champions excellence in patient care, leadership, and equity in healthcare. She also serves as an adjunct lecturer at the Lawrence Bloomberg Faculty of Nursing. Before we begin, we encourage you all to engage with us by submitting your questions in the Q&A function in the toolbar below, and we'll address them during the Q&A segment. Now, please join me in welcoming moderator Ava to lead this discussion. And Ava, feel free to take it away.
Thanks, Jade. Thank you guys for joining us this evening. It's such a pleasure being here tonight. I just want to start off by saying Happy Black History Month. Such a pleasure and privilege to be celebrating that with you all. It's such an honor to be doing this with University of Toronto Lawrence Bloomberg School of Nursing, being a past alumni from U of T and also an adjunct lecturer with the school. It's just an honor. Tonight, we're going to have the opportunity to discuss some really amazing topics as it relates to leadership, policy, advocacy, innovation, and really seeing and showcasing the amazing work that our Black nurses are doing within the landscape of Canada. Tonight, I am very honored to be here with Dr. Cooper Brathwaite. I hearing all the accolades and all the amazing things that she has accomplished during her time and she's still supporting different initiatives, still advocating, still making her presence known. I'm just honored to be in your presence and I celebrate you, and I just wanted to just even ask if we could just send some hearts to her, as she's recently retired, and I just want to celebrate her tonight. Thank you. Um, Also wanted to say what an honor it is to um, participate alongside Ovie Onagbeboma, our CEO of the Canadian Black Nurses Alliance, and recognizing the impact that you have on the Canadian landscape in terms of really inspiring and empowering another generation of Black nurses to enter into leadership and to be innovative in how they approach healthcare in general. So tonight we're going to start and open up our discussion, looking at the amazing band of work that these two individuals have done in their time and still is doing. I wanted for them to each share with us tonight um, some key things that came forward in their journey. When we look at their journey, it's been diverse. They've been involved in different areas of leadership, of healthcare, and recognizing that. What is one of those defining moments when you're looking through your journey where you realize the power of leadership in shaping healthcare? And sometimes that um, recognition occurs in our own looking at our own journey. Sometimes it's seeing other leaders, sometimes it's seeing the people around us or seeing the need that's there. But what was that defining moment for you? And I'll start with Dr. Cooper.
Thank you. It's a privilege to be able to speak to you this afternoon on such a momentous occasion. A pivotal moment in my career is when I first saw firsthand the impact that leadership could have in driving systemic changes in the healthcare system. In 1997, as a director of nursing at an acute care hospital, I was responsible for the program Maternal and Child Care. This was a program that had multidisciplinary staff. This program came into being following re-engineering and downsizing. I don't know how many of you would remember that if you're that old. So we had to make significant changes throughout the all organizations had to make significant changes. So we went to a program management structure. So I had about 390 something FTEs reporting to me in this program. It means I cover the birthing suite, the NICU, pediatrics, day surgery, postpartum, the breastfeed clinic, non-stress clinic, all the supporting clinics. So I had all these multidisciplinary staff, no managers. So I ran between floors to meet the needs of my staff. And at that time, the provincial government implemented the early discharge program for mothers and babies. So within 12 hours after delivery, women could leave the hospital and go home. When I look at what was happening, there were many breastfed babies that were dying from jaundice. Mothers did not recognize if the babies had jaundice, particularly breastfeeding mothers. And I was attending a meeting, and former Minister of Health, Elizabeth Whitmer, attended that meeting, and I got an opportunity to speak with her. And I told her how many breastfed babies were dying in the community from jaundice because the mothers did not have the skills to recognize it, nor the knowledge. And I said, could you please help us? She listened very closely to what I had to say, asked a few questions. I provided her with the evidence. And within less than a year, she had that program, Healthy Babies, Healthy Children program, came into being. And of course, being the director for the program, I had to educate all my staff about how we go about that. And of course, I assisted public health because it's a program that bridges public health and maternity units. So after having that kind of support from Minister Whitmer, and I saw how quickly things could turn around at the provincial level, that led an indelible mark on my mind. So that experience shaped my approach to advocate and influence decision makers at the provincial and federal levels to create or amend healthy public policy, which could usually take 3 to 5 years or more. And this took less than 1 year. And that program is still sustainable today. It's still continued in public health, between public health and maternity units. Thank you.
Wow, that's amazing. I recently took on leadership over the Winds and Children's program at our organization, and just hearing your story is just so inspiring for me as well. Just recognizing the opportunity we have to cause meaningful change, and actually, um, you know, the role that advocacy play in terms of recognizing a problem to be solved and really not leaving any stone unturned to get to it and making sure it happens. And wow, amazing. One of the things I will say as I looked at all the things that you've done and hearing this story is recognizing that our work and our impact as leaders and as Black nurses are not isolated to any one area. It goes beyond where we are practicing, it goes beyond where we're sitting, and it goes, provincially, federally, into the community, in the acute care setting, in all settings. So thank you for sharing that. And I'm going to turn it over to Ovie to share her defining moment with us as well.
All right, so good evening, everyone. For me, I think I'm gonna say from birth, I've always been fond of leadership. I'm the only girl of 3 boys. My mother has always exposed me to leadership. So in terms of leadership, whether it's formal and informal, it's always just been something I enjoyed. As I reflect now, as someone who gets to speak, I reflect to days in the classroom where I used to put my hand up and I wanted to present. And when I look at my nursing journey, when I was a frontline nurse, I had this wonderful career where I was always sponsored. I was always seen for the value that I brought. I, navigated my frontline journey as an emerge nurse, ICU nurse, working in environments where learning and innovation and asking questions was just truly supported. I think for me, the pivotal moment was going into a formal leadership role. And that is when what I noticed in my journey within a different unit was the necessity of Black nurses going into leadership, but also the resistance that comes with our presence being formal leaders. And it was that opportunity, as I can look at it now, as it brought a lot of pressure, it challenged my growth as a formal nurse, but now a formal leader. It allowed me to learn what was this teaching me about who Ovie is and why Ovie is so important to this industry, to this profession. And in that pivotal moment of navigating that experience, the birthing of the national organization, which I will say, I think I'm known for that within my nursing journey, Canadian Black Nurse Alliance was birthed. And the why behind that was recognizing that some of the common stories, the patterns of Black nurses is the moment we go into formal or informal nursing roles, our experiences shift. Our challenges become faced with things that we notice that are barriers, experiences where the people and the way how we know ourselves, that narrative is now being told that doesn't match who we are. And the birthing of Canadian Black Nurse Alliance was this vision to ensure that leadership is seen as more than a title. It's about creating space for others, walking into advocacy in a way that our profession needs. Our profession needs consistent voice around issues that matter to all nurses. And that change is definitely uncomfortable, but it's necessary. And, being an effective leader doesn't mean avoiding resistance. It means being prepared for it. So oftentimes I get asked, like, what do you like about leadership? What do you like about management? And the answer that I give is the autonomy to be able to show the creativity that you have within yourself. But the biggest thing that I love with leadership is serving others. And it comes with challenges. It comes with you realizing that you are a vessel and a vehicle to empowering others and being that light in a day where there's challenges and there's different ways of thinking. And I do see that just going into former leadership and what it was trying to tell me who I was not was the pivotal moment of me defining and creating a pathway for all of us to be able to feel comfortable showing the world who we really are.
Thank you, Ovie. I think you said two things that really stood out to me. One was, being prepared when the resistance comes, and also recognizing that you're in your leadership journey, there are moments when you are told who you're not based on what you've known about yourself. And I think what that brings forward is, in the journey of nursing, in the journey of leadership, in the journey of being a Black person in all those spaces, is that there is an importance in knowing who you are. There is an importance in recognizing why you're doing what you're doing and why you're in the spaces you're in, and that you also have power, not to oppress but to actually remove oppression and remove barriers and create space for others. And so I think that's such an important message to bring forward. As we look at policy and system change, you know, doing this work, the logistics of it sometimes become very burdensome, and there are lots of challenges with it in just the normal day to day. But I guess what I want to understand is, as Black leaders in these spaces, how do you navigate that in such a way that allows for meaningful change, and not just meaningful change, but change that is sustained after you've gone. And I think the story Dr. Cooper shared earlier showed that what you do will live on when you do it well. But as Black leaders, sometimes there are unique challenges that do come up in creating that system change, in doing that policy advocacy. And so how do you navigate that in a way that results in change that lasts? I'll go back to Dr. Cooper. You're muted, sorry.
Sorry. I like to share an example of how policy, I should tell you, there are two things in nursing that I like very much. Besides being, I enjoy being a clinical nurse for so many years of my career. But as I grew older and I got more advanced education, two key areas of nursing stood out for me, and they are being a researcher and being a policy advocate. And for me, they cross over because they both involve literature review, critical thinking, and all that sort of stuff. So I like to share an example, what helped to shaping healthcare policies. And this example is how policy advocacy could lead to meaningful change. Prior to 2005, the Highway Traffic Act in Ontario did not include one seat belt per person in each vehicle. A group of Chinese visitors from China were involved in a motor vehicle collision in Ontario. Some of them died, some were badly injured. There were insufficient seat belts in the vehicle to accommodate them. This situation motivated me to advocate for changes in the Highway Traffic Act. I should say to you, at this time, I was a regional manager in public health, and my portfolio was injury prevention and substance misuse. So we look at all injuries that people might sustain, and motor vehicular injuries was one of them. So I collaborated with local and provincial governments, the RNAO, OPHA, Smart Risk, Safe Kids Canada, and 35 public health units to influence the provincial government to amend the Highway Traffic Act. One seat belt for one person, limit the number of seat belts to the number of passengers in a vehicle. I met with local and provincial politicians in the constituency offices, attended the annual general meetings of OPHA, Ontario Public Health Association, the RNAO, to present a resolution entitled Amending the Highway Traffic Act, One Seat Belt for One Person. This resolution was supported by the voting delegates at these annual general meetings. I also presented a report with supportive evidence from the literature to the provincial government standing committee at the legislative building at Queen's Park. The Highway Traffic Act was amended in 2006 by the provincial government and became law. I'd like to share another example. After presenting a research study at ICN Congress in Singapore in 2019, I was greatly disturbed that Canada did not have a chief nurse at the federal level. Developed and developing countries had a chief nurse bring greetings to the international audience, and Canada was omitted because we did not have a chief nurse. At the time, I was the president of RNAO, and Doris Greenspan, the CEO of RNAO, had a little chat. And we discussed this issue and thought we must do something about this. So during Nursing Week 2020, this is during COVID, we had an online meeting and we dialogued with the Prime Minister Trudeau about this issue. We asked him to reinstate the chief nurse at the federal level. Following this meeting, we sent several tweet messages to the Prime Minister telling him the importance of having a chief nurse at the decision-making table in Ottawa. In 2021, Prime Minister Trudeau promised us that he will reinstate the chief nurse, and in August 2022, Prime Minister Trudeau reinstated the chief nurse at the federal level. So I would like to say to you, I love policy, I love research, and I try to combine the two together. And those things motivate me. Wherever I see a gap or a problem, if I could do it, I will go after it.
Thank you. That is just so beautiful. It's beautiful because this is something I think the different individuals that are attending today, you're having from students all the way through, and this is such a strong point to drive home, seeing a problem and doing something about it and not letting it sit, um, and not thinking that it's something bigger than you. Like it's not a problem that's bigger than you, that if you let your voice be heard, that you actually can cause that change that you want to see. um, I'll open the floor for Ovie to share her answer for that question that I asked as well.
Yes, and thank you, Angela, for bringing up. One of my answers was the reinstatement of the chief nurse officer. And I think just to piggyback on that, when nurses are not at the table all the way up to, the federal government level, then our voices are not going to be heard. Our issues become ones that are not important. And we are probably one of the most largest workforces within the healthcare system. And just to kind of speak to that in terms of the question, I think it's important when you're doing this work is the data, the experience. Angela, emphasized the importance of research and being in policy and advocacy. And I think to those who might shy away from research and might shy away from advocacy, there's many ways that you can be part of that change without having to have a passion in those areas. So again, this is a collective power, right? We need a voice, one voice as a healthcare profession, as a nursing body, coming from various avenues. And I think my example that I would love to speak to right now is the Bill 124. And oftentimes, sometimes we may forget how that affected other professions outside of nursing, because it appeared that nurses had the largest voice with that bill. And I think when you look at Bill 124, our wages were capped from 2019 till about 2023. And it wasn't until recently where that just really, truly got thrown out of the court system. And when you look at the advocacy that we witnessed from all walks, right, from RNAO to individuals who advocated on Twitter, to the union organizations, it was coming everywhere, from teacher unions. And it just shows the power of a united voice. It shows the power of the importance that when things are put in place that impact women, that impact disproportionately the Black and racialized healthcare workers, when you're looking at worsening our retention, when you're looking at workplace inequities, where we're being told that we're valued as a profession, as this was happening throughout the pandemic and everyone was, clapping pots and they value nurses, we were seeing the opposite when it comes to our economic standing as professionals. And I think kudos to, at least on my lens here in Ontario, I saw the advocacy of RNAO. I saw the advocacy of nurses who pick up their cross. There's Amy, there's Brigitte Umba. There are people just doing their part. And I think watching that in that period where they were persistent, they didn't stop talking about it. Right. So when the celebration of it, being struck down, when you saw them talking about it, I remember sitting here and saying, these people went to bat and they woke up almost every day and never put down the subject matter. And I think that is the example that we need to look at. And I had the privilege of having that example and understanding what the different variations of policy and advocacy can look like and should look like, and seeing the reward at the end of that. So to kind of wrap up what I'm saying, I think it's important to have the data, the lived experience, build collective power, and strategic persistence is the way to go. Sometimes we want the change and we want the solutions to come right away. And we've like, it's been 5 years, right? And we forget that, there's a paving of the road that's been happening in everything that we do every single day. And I think, to speak back to what Angela's saying, I think, you cannot truly be the best leader, the best nurse, if you don't love the advocacy part of our work. And I think we learn so well to advocate very well and make sure our policies are very good for patients, forgetting that that can be us one day. So we have to also know how to advocate for ourselves. And I think Bill 124 literally amplified and showed us that, that's the way how we do it.
Thank you so much. I think both of you brought home the point around what we have that's unique to the nursing profession, the ability to look at life through holistic lens, to see what is needed from a big picture, and recognizing that you put all the pieces together and you're not neglecting an aspect of it. And so I think that's one of the key around advocacy as well, is not just focusing on one thing, but looking at the impact that one thing may have on something else, and making sure the work is it comes with equity, comes with appreciation for diversity, is inclusive, not just in terms of the people that you're serving, but the systems that are at play, the literature, the departments, the industries that are a part of that work in order to cause that change. So I think that's just, it actually lends itself to the next question that I wanted to go into around leadership and workforce retention. As leaders, we have the responsibility to have reports, direct reports to us, but how do we retain, especially when we're looking at some of the challenges that nurses are experiencing within the healthcare system, some of the experiences that they're experiencing because of the color of their skin. And when you're looking at some of these challenges, what role would you say having diverse leadership and mentorship, what role does that play in helping our Black nurses in the profession advance into leadership position, and also sustain that, building a sense of presence where there is succession planning and all of those pieces. I'll ask Ovie to start us off.
I love leadership, retention, mentorship questions, because I think I'm an example of that. I'm an example of an individual who's had modeling of true leadership. And, when it comes to leadership and it comes to mentorship, sometimes we have bad stories, but it's those good stories and the impact of those good stories that I had throughout my journey that makes me know the importance that it takes for leadership and mentorship to play in the sustaining and the recruitment of diverse nurses, of diverse individuals, and wanting to be part of the good stories, right? So modeling what true leadership looks like, the authenticity of that, being able to get to know all walks of people without the assumptions, right? So that's coming from an intentional, inclusive lens. That's coming from an impact lens. That's coming from a lens that drives innovation. So, you can take leadership courses and you can, go to conferences, but at the end of the day, are you translating it to meet the needs of who you're serving? And who we serve, it's not a cookie cutter. So when you're looking at the impact that leadership has on retaining, particularly our Black nurses, if we don't have that retention, if we don't have the diversity in the representation, and we don't have the diversity in who's our Black nurses are getting exposed to from academia, from our education system, then we're doing a disservice as it relates to removing barriers. We're doing a disservice as it relates to changing the narrative. we're doing a disservice as it relates to our abilities to sponsor, right? I think a lot of times we talk about mentorship, and it's great to have someone that I can call. I have that privilege of calling people and, dropping some of my thoughts and challenges to get that wisdom from them, or to make sure that I'm not gaslighting myself. But one of the cornerstones of the early years of my nursing career, the first 9 years, when I look back and introspect, at each journey, I've been sponsored. And this sponsoring is an interesting thing. It started from undergraduate school, as simple as just wanting to go to Emerge and having a professor who says, go. And you might want to go to this hospital so you get the experience you truly want versus the big house and the shiny lights. And I was like, okay. And I listened to her. And then going into Emerge, within 6 months, someone who was in the ICU at another hospital is like, it's time for you to go to ICU. And I'm like, I just got here. I just came out of the new grad initiative program. You're ready to go, right? And they pushed me beyond that narrative that I had to spend my time and put in my years and pay my dues. And I went to the ICU within that 6 months of graduating nursing school. And then the story goes on in terms of sponsoring. And I think those are the things that makes a difference in any nurse's career, but particularly Black nurses' career, is when people see your abilities beyond you even recognizing them, and they're not intimidated by it, but they're able to lift it out of you and push you down that pathway where you go. And I think when you look at leadership, when you look at representation, I think one of the things that we forget to look at in representation beyond the skin is, how do we truly serve the community that walks through our doors, whether it's in a nursing school, whether it's in a college, whether it's in a hospital? How do we truly serve them if we don't have diverse people at all levels? How do we truly meet their needs if we don't have diverse people at all levels? And sometimes someone doesn't believe they can do their master's until you whisper that word to them. And I think when you look at leadership, you have the opportunity to intersect with people and become that catalyst, become that voice of go ahead and do it and make a difference in somebody's life and impact. And when I look at mentorship, that was one of the biggest things that I knew was the successes to my story. Is I had mentors. And it wasn't something that I intentionally looked for. It's something, fortunately, I was attracted. And that attraction of mentorships was beyond just the nursing profession. I've also been sponsored to go to emerging leaders, right? Way before I became a former leader. So when I look at mentorship programs and just even co-founding within the CBNA and mentorship programs for Black nurses and undergraduate students, the biggest why isn't to make sure they are, connected with Black nurses. The biggest why is to make sure they're connected with like-minded people who will catapult their career and give them what they need to know and hear to be successful as they move forward in this nursing profession. So for me, when you look at mentorship and leadership, it's a pipeline, it's access, it's a network, it's diversity, and it sustains our workforce, and it also brings attraction to our workforce. I will do a small plug, but when I look at what's happening within Canadian Black Nurses Alliance and all these mini academic chapters springing up, with the most recent one being in Saskatchewan at the University of Regina and Cape Breton in Nova Scotia. What happens when you have that visibility for nursing students trickles down to a high school student seeing themselves as being able to pursue nursing because there's someone that looks like them. There's someone that's speaking about their journey and utilizing the various technologies that we have to promote that. So I'll stop there because I can talk forever. But one thing that mentorship does, it reduces the shame in our experiences as we face barriers. It also reduces isolation, but the biggest piece is it accelerates and empowers Black nurses to go after what they want to go after.
Wow. Wow. I think I am I'm touched by the last thing you said because I have been in that journey where I've experienced and seen it firsthand, where um, when you're walking on the journey, sometimes you see the things happening and you feel like you're the only person in the world experiencing it. And the beauty of mentorship is knowing that you're not alone. And that gives you all the power you need to keep going, all the power you need to continue and persevere um, and also evolve from a place of this is all I can do to knowing that there are other possibilities and there's more to do. So very key point that was highlighted there. Dr. Cooper,
It's
I know
my
you have a
turn,
lot
eh?
to share.
Well, I always have a story to tell. First, I'll say leadership and mentorship play key roles in building trust, respect, growth and development, job satisfaction, and career advancement. I have attended or graduated from 3 Canadian universities, and I never had a Black mentor, teacher, dean, or professor. But I was educated in the Caribbean, and I had a Black dean, Black nursing director, Black mentors. And as a 4th-year nurse in the Caribbean, I just took my RN exams. I was in charge of a medical unit, and the night supervisor, this was a night shift, said to me, Angela, I want you to go to Unit X because they're short-staffed, the manager is not there, and could you help that nurse? I think she's having some problems. So I went to the unit, and there was this young nurse. We had a patient who was in diabetic coma, and she didn't recognize it. And I'm saying, when last did you wake this person up? When last did you test the blood sugar? And she was saying, well, I couldn't get her up. So I got the trolley. In the British system, they say the trolley. I put everything that was required to start an IV and whatever. And I called the physician. I said, do you know who the physician is? And she said she didn't know. So I called another unit, and they told me who the physician was. So I called him directly, and I said to him, Dr. So-and-so, there is a patient who is going into diabetic coma. I want you to come and see her right away. He said, I said, I need you to come and see her right away. I have to go back to my unit now because it's time to serve all my medication. This is an infectious disease unit I'm working on. I have to go back there. So I left, and the nurse, I make sure she had everything in place and ready for this doctor. Well, next morning when the shift was over, the night supervisor came to visit me. I'll never forget. She said, Angela. I said, no, Nurse Cooper. I said, yes. She said, Dr. So-and-so is going to see the matron. This is the chief person. In England, they call them the matron. In the Caribbean, we call them the matron too. He is going to see the matron about you and said, this nurse demanded that I come to see this patient. I said, oh. Anyway, he did go and see the matron, and that matron stood up. She said, she is right. I expected you to come and see that patient. She did what was right. And that woman, the chief nurse for this big organization, a 900-bed hospital, supported me. Here is just a junior nurse starting my career. Not a Black nurse, and I was a student then. She had all the surgical patients who had infections. So students never wanted to go to that unit. We were allowed to have 2 weeks off in one academic year, not academic, calendar year, that we could take for sick time. That's the time everybody take the sick time when they had to go to this unit. But I went to this unit, and this woman was so compassionate and caring. I never took 1 day sick leave while I worked on that unit. And she was the nurse who gave me a reference to get my first job. So I had 2 women, Black women, one at the highest level, one was a manager, who demonstrated what it is, good mentorship, And that woman who had all infectious diseases, she used to come and say, Nurse Cooper, come with me for the day. And she would have me walk beside her, and we do the dressings of all. We did QID dressings. All day you did dressings because there's so much infections, okay? You used to smell the unit outside the unit, okay? But I'm telling you, because of their role modeling, their behavior, their compassion and the caring and the support they granted me, I am here today and I mentor other people. So a good mentor helps to develop the mentee, if you're looking at, or you could have group mentoring to help people advance to the career and move through the system. But you role model that for them.
Thank you. Thank you very much. I love mentorship. It's definitely one of my biggest passion, something I take a lot of joy in. And just like you, I've had someone pull me and be like, "You're doing this. Get exposed to all these different things." So it's definitely works, and it definitely helps us to move forward. And you always want to pay it back. And I think, when we're looking at that, looking at paying it back and also looking at the generation that's coming up, our future Black nursing leaders, if we were to look, say, 10 years into the future, what's one of the bold change you hope to see in Black nursing leadership? And I think one thing I want to add to that is in seeing that vision of what you would want to see in Black nursing leadership, what role would you play in making sure that happens? Or what role can we play in making sure that happens? I guess Dr. Cooper can start.
Okay. Well, I would like to see more Black nurses in leadership positions such as Dean of Nursing, VP of Nursing, CEO of a healthcare organization. I would like to see that. And what role would I play in making this happen? Or us, the roles we could play in making this possible? I would say coach and mentor your Black nurses who desire leadership positions so they could achieve their goals. Assist them in developing a bank with interview questions. I will encourage all nurses to create a bank of interview questions following an interview. After each job interview, please add the interview questions you were asked and put it in your bank. Conduct a mock interview with candidates before with your mentee or someone who's going for a job interview before they have the real interview and provide feedback on how they can improve their responses. Assist them in developing a good CV, highlight key areas of the experience that match the job position they're applying for. Encourage them to volunteer in different healthcare organizations as board members, whether it's hospitals, universities, nursing associations. Advocate for changes in structural inequalities such as policies. I personally believe all employers must have a policy on zero tolerance of racism in their organization. Changing practices. You need to change hiring practices to include a diverse group of interviewers with representation of Black and BIPOC members on that interview team. And in education, whether it's orientation or continuing education, I think we should include information about racism as a social determinant of health, cultural safety, cultural competence in the continuing education programs for all staff. Advocate for health organizations, whether it's academic institutions, government agencies, to collect race-based data. And some people, after working with the College of Nurses, when they collected the race-based data, they race-based data that said some people were reluctant to identify themselves. And I understand that. But I will say the race-based data is important to collect since it provides the landscape of racism in a culture, organization, or country. Race may influence the way we are treated by individuals, institutions, and this may affect the people's health, job promotion, employment opportunities, and determine where they live or work. I have some colleagues now in the United States. I met with them last week in an equity group, health equity, and they were really down because some of them had grants for the research and it's now canceled. They told me they cannot use the term equity, they cannot use the term inclusion, they cannot use the term diversity in the research or whatever. It was very sad. A meeting that was supposed to last 1 hour, last 35 minutes because members, our colleagues in the United States are really experiencing some real challenging times. And when they thought after we had that incident of the brutal killing on George Floyd in 2020 that things would change, we had Martin Luther King Jr., who fought for all equity and all that stuff, they feel that they have gone backwards. And we don't know what our tomorrows hold, but I would say to treat each other as the way you would like to be treated. And there's something I learned from the indigenous people. I work in Northwest River with the indigenous people. And one of the things I learned with them, living with them, is they had a saying, never judge a man unless you have walked 3 moons in his moccasins. In other words, you must experience what other people experience to understand how it feels. And there's only one race, it's the human race. And I'm going to stop there.
Well said. Thank you so much for that. I'm going to turn it over to Ovie to also share what she thinks as it relates to the future.
So now we're approaching year 10 and everything that Angela said is now implemented, right? At all levels. So my one bold change is we no longer have to talk about representation, right? So what does that truly mean? Is when we look at our institutions, when we look at our healthcare systems, our patients no longer have to experience the results of a lack of representation because that health equity, that diverse perspectives from the representation that we no longer talk about is normal. I sat with someone on Monday, and it was at work, and they were just explaining something to me, which I've never, and if someone's heard this analogy, that's fine. But they were talking about what representation is in its current state within our profession. And they were talking about the salt jar and the pepper jar. And they said, well, Ovie, think about it this way. Even if you sprinkle pepper in this salt bottle, a little bit of pepper in that salt bottle, it wouldn't even funnel down in this salt bottle. It still remains the dominant property in this bottle. That is what you're seeing in the example that you're giving right now. And it actually made me pause and think because the experience that I was sharing was a bit of a bubble, I must say, in seeing representation versus the overarching representation of this particular discussion we were having. And I think sometimes when we are on this journey of representation, sometimes we get comfortable or uncomfortable with hiring 1 and 2 and hiring 3, and then we stop. And I think it shouldn't be where we stop and think, oh, we have too much diversity. It should be, how do we make sure that our patients are going to get the perspectives, the specialties, the thinking, the voices that are going to understand what they're going through and speak to how we meet the needs of the people who come through our door. How do we meet the needs of the nursing students and the physicians who need to understand what it's like to make a diagnosis on a Black skin, on a brown skin? That's the conversation that we need to have. And back to my one bold change, we're no longer talking about representation because it's the norm.
Thank you, Ovie. I want to thank you both for those very insightful and powerful words that you've shared. I will say that as we look forward and we're talking about, seeing it representation and not having to talk about it from that perspective, it is so crucial to the safety of our patient populations. It's so crucial to the safety of our healthcare system. It's also crucial to the safety of every sector we work in. And when we think about it from that perspective, it's not isolating it to race, but also embracing also the different disciplines, the different areas that we engage with, the different contributors to thought and ideas, and making sure that is reflected in what we do. And so I look forward to 10 years where it's no longer a question of if, but when we get there into leadership. And so I thank you guys for participating. I know we are at time. I did wanted to open to any question if there was. I didn't see any in the chat.
May I add one more comment? I like to say to the audience, including myself, don't compare yourself with others. You are unique with different talents, skills, knowledge, and abilities. Use them for the betterment of society, the workplace, and others. Don't compare yourself with other people. And too many people do that. It's not a good thing to do. Be authentic, be yourself. And I remember having to tell members of the board of RNAO when I became the president. I'm laughing now. After chairing my first meeting, we look at the minutes and we analyze the results of what people, evaluations that they give. And there were some comments about myself. I said to Doris Winspan that I need to address the board the next meeting I was chairing. So once we got settled, I said, I have some information to share with you. I just want to let you know, I am unique. I'm one of a kind, and God help me if I fail to be myself. I can't be like your former presidents. Don't expect me to be. I'll never be. I am one of a kind, unique. There'll never be another Angela like me, okay? So don't compare me. Number two, if I'm angry, I don't speak. I remain silent. If you hear me get loud, it's because I'm excited about what I'm discussing and talking about. But don't compare me. And after giving that information, and Doris added a few words to it, it changed the tone of our meetings. Be yourself. You're one of a kind.
I truly appreciate that. Because a lot of times we go into leadership and the thought for many, especially new leaders, is that they need to fit a mold. But that doesn't work. You need to really be true to yourself.
Yep.
And so I thank you for that example. Jade, do we have time to answer a few questions?
Yeah, we can take a couple more questions.
Thank you. I see a hand up, Nicole.
Hi, my name is Nicole. I want to thank you all for like the insightful presentation that you provided. I just have a general question. So I'm a nurse, and I'm an aspiring nurse manager, and I'm just wondering, what do you think would be like the number one thing that you think I should do like in the future to kind of create a more like diverse environment? Like I'm really passionate about inclusivity and everything. So what do you think? Because I want to create like, a very positive environment where, like diversity is reflected in policies and the environment.
Would like to go for it. Go ahead, Ovie.
So Nicole, nice to meet you. And I love leadership, so go for management. And I think the biggest piece to it is having a vision, which you have one. That's the first thing. With your vision, I will encourage you to write it down, because once you write it down, then you can run with that vision. And as you get into, a manager role, recognize that despite whether you are in that role, you can start to model the inclusive environment that you want to see, and that positive environment and the diverse environment. The biggest things is, who do we see quiet in our unit that need to be encouraged to take on opportunities, right? Opportunities such as charge nurse, getting involved in the various courses that are offered. But it's also important in your recruitment process. One of my styles of interviewing is following the interview guideline and asking a little bit more questions to get to know the person that I'm interviewing. Because in terms of the environment that you want to create, you have to be able to attract what you're trying to create. So you're trying to create a positive environment. You need to be able to recruit people who are going to, fill into that environment. So I think the biggest thing for me is, when you have a vision, write it down, stick to it. And in anything that you want to do, if the environment is currently not at that state, make sure that you have people who will support what you're trying to do, so you're not going against the grain. And if you are going against the grain, still establish the environment that you want to establish within that unit, as long as it's positive. So be consistent, write it down, you have that vision, and make sure that you're always learning and unlearning any unconscious biases or any assumptions that you may have that could be a barrier. And that advice is irrespective of race. Because sometimes we look at someone's resume and they may not present themselves as well, but you have the opportunity in an interview to ask more questions to get to know that candidate, right? So just being very open and diverse in yourself when you're bringing that environment into the unit that you're managing and leading.
Thank you, Ovie.
The only thing I would add to that is, you don't have to wait until you get into the position. You are a leader. I've met clinical nurses, they shine as leaders, and put those skills into practice with the people you work. Because by putting those skills into practice, people will observe how you handle different situations, and you will be building those skills. People will give you feedback on them. Don't wait until you're in the job. Start being the leader at the clinical bedside. I remember working at the clinical bedside, and certain nurses, if you hear they're on, you don't want to work, period. It was a discouragement. You don't want to work because you know what to expect, the behaviors. So because you are a leader in the clinical setting without being in charge of the unit, demonstrate those skills to other people. People will observe it and treat them with care and compassion. Everybody likes to be felt welcome or be cared about.
I just want to add one more piece, if I can. I think as you lead, again, leadership is not a title. So as you go into these formal roles, just remember, even before you're in those formal roles, what you tolerate persists. So if you tolerate a positive environment, that environment will persist to be positive. If you tolerate a toxic environment, then that will persist as well, right? So just being mindful of that. And I think anything that comes with leadership, you're going to get opposition, you're going to get resistance. That should be your marker to keep going, right? If no one's resisting the change that you're bringing that is needed, then you're probably not bringing forward impactful change. So when you have that resistance and opposition, what I will say, Nicole, is to keep going. And the mentorship piece matters, having people around you to buffer some of the things that you will encounter from making those positive changes.
Thank you, ladies. Any final thought?
Yeah.
Actually, I do see a question here from Lisa. It says, as a Black leader experiencing resistance, what strategies did you utilize to build networks and develop alliances and coalitions?
I think I can answer that. I think outside of the things that we spoke about with the mentorship and having a network, I think it's important that in any environment that you're in is to not stay isolated, right? And attract and seek like-minded people. There are great people in this world. There are great people in environments. And I think the biggest thing to resistance and opposition as a Black individual is trust your gut. I think some of the things that we often do is we often discredit our experiences, and that causes more harm. So I think it's very important to recognize when you know what you're feeling and something's off, but also to make sure that in this journey of navigating resistance is protecting your mental health, knowing that your wellness and your well-being is paramount and important. And the one thing to steward that is having a network, and it doesn't have to be in nursing. So if you're not seeing it in nursing, or it's not making you feel like you're getting enough, be open to diverse people outside of nursing. And I think that's the biggest thing that you can do. What I will say again too is it's important to be your authentic self. You know, Angela drove in on it. The worst thing you want to do is fail at being yourself. And I think that's such a powerful statement, because if you're not going to be yourself, if you're not going to operate as yourself, you're not going to attract the people who are meant to be part of your life, the people who are meant to see the value that you bring and utilize the value that you bring, and be around the community and the work environments that you're supposed to be in. And I say that in the sense where when I look at the Canadian Black Nurses Alliance, the founding members of Canadian Black Nurses Alliance did not know each other before. We were complete strangers. The one common thing is we believed in the mission and the vision, and we were nurses by background. And myself, Karen Pingal, and Ava, people would think that we known each other probably from, babies crawling, and that's not the case. So me operating as my authentic self, Ava showing up as her authentic self, allowed us to attract each other and be able to go on this beautiful journey. And that speaks to a lot of the amazing people that I've gotten to meet and learn along this journey. So it's hugely important to know who you are and walk in your authentic self, and do not discredit your experiences. Do not suppress your experiences, because that impact trickles into your well-being, your mental health, and that can impact you health-wise. So remove any shame that could be attached to it, fair, and find people who care about you as a human being. I think that is the biggest piece. You will find people who care about you as a human being, and that is irrespective of race. There is power in people who understand that, but don't box yourself, and that is the only people who will understand what you're going through.
I would just like to add, and I've had to do it before, and I think I alluded to it about being the president of RNU first meeting. I would not let that go I will talk about team building. I'll say it. I've noticed we are having some difficulties here. I like to work with the whole team. We are going to do some team building, and everything is on the table. I've noticed, I will say what I've noticed and let everybody contribute to that discussion. We will have a discussion, even if it takes 2 or 3 meetings to have that discussion. I will not let it go unattended. We will come and we will talk, we will discuss and come to some kind of resolution, because you don't want to have a toxic environment to work into. It just eats at you and it really affects other people. So I will make sure I bring this. I said, look, I noticed like some of us have on different wavelengths. This is a team. I would like to do a team approach, and I would like to have we're going to separate times for these meetings, and we want everything is on the table. Let's discuss it. Let's hear from other people. What they like, what they don't like, whatever. And what's discussed in this room stays in this room. I'm not going to let it go. I'm going to make sure people sit at that table and discuss it.
Donna, thank you for that. That is very inspiring for me as a leader, because you do encounter those situations where there are things that you're observing, and if you do let it go, all it does is fester and grow and become toxic.
Yeah.
And create, it's a rot that occurs, right? And you really need to nip it in the bud. And sometimes you have to have those difficult conversations, and it actually creates a stronger team because of it.
Mhm.
Yeah.
I think we will close the Q&A from there.
Thanks, Jade. I just want to thank you guys for coming out this evening. I want to thank you guys for being present and engaged in the discussion tonight. I want to thank our guests tonight, Ovie and Dr. Cooper Brathwaite. I want to thank the U of T team for curating this session and allowing us the space to learn and garner insights and be inspired and empowered by our Black nursing leaders. And I know that we will be better for it, and that we will be stronger because of it. And we will also take stance for advocacy, stance to cause and lead change, stance to empower another generation as we look forward. So thank you guys for being here tonight.
Thank you. And just before we go, I also want to thank all of you, Dr. Cooper Brathwaite and Ovie, for your leadership and your advocacy and providing insights with everyone tonight. Especially thank you to Ava for really guiding this important discussion. Also, as I could say as well, I encourage you all to reflect on really what discussion was about, and consider how you can support change within your own spaces, and amplify the voices of Black nurses and health leaders. And we also hope that you will be able to remain connected with Bloomberg Nursing, especially its initiatives that promote equity and inclusion. And also, I would like to invite everybody to consider supporting the Graduate Nurses Society Black and Indigenous Student Award. This award helps to provide support and additional resources to students that are deeply affected by systemic racism, prejudice, and inclusion and inequity. So also, if you provide a $1,000 donation, for example, you will be matched. And the matching begins from now until March 26th. And the link will be provided in the chat, so feel free to check it out. And again, thank everybody for coming and really participating and engaging in this session. I hope you have a great night.
Same to you. Bye.
Thank you, everyone.